I had been working in a brick and mortar primary care clinic and was beginning to realize I was getting really burnt out, and started seeing more and more older adults in my practice and realizing that it was easier for me to go see them at their home than it was for them to come in and see me. I had known about Housecall Providers for years. I'd kind of had it tucked in the back of my head as this is a group that I know has been around for a long time. They have a good reputation, really the patient at the heart of the organization. And I've only worked for nonprofits because I want to be sure that it's truly serving the patient. And I feel like Housecall Providers totally represents that also. I'm seeing about 6 patients a day on average, I would say. Sometimes I go to a community where I have a bunch of patients, so I just end up in one community all day. We have really good, I think, cross coverage. So if you have your day off, or if you're off on vacation, there's somebody that's covering your panel, because we each have our own panel of patients. Sometimes I have a few patients in one community and a few patients in another community, so there's some driving in between. So when people ask me where my office is, I tell them it's in my car, which it literally is, because when you're a Housecall provider, you got to carry with you everything that you need. My bag is what I carry with me all the time, so it's got my computer and then some papers and then all of whatever I need to do my exam. But then I'm always thinking about what might I need, like if I was in a clinic, what would I have in the drawers and the cabinets? We do use a mobile lab, so we have mobile phlebotomy, so they'll come out and draw whatever labs we need. We also have mobile x-ray, which is really huge. They're both community partners. It's not just me, the individual provider, but I have a whole team behind me that's working. And that includes a social worker and a nurse and my care coordinator. At my disposal, I have a pharmacist and a chaplain, and we have a durable medical equipment queen, I call her, because she sorts everything out. I think it's a very egalitarian organization. Whether you're an MD or a nurse practitioner or PA, are seen very equally. There's a lot of camaraderie between us. It's an organization that comes with a huge depth of experience.
We've had Housecall Providers for about 6 years now. For me, the major difference between brick and mortar, taking mom out, versus having the medical care in-house is I don't have to be her chauffeur, because it's hard on mom too to get in and out of the car, sit down, and then we always wait. We laugh at each other. Well, half our life is just waiting. So it's just so much easier. I think for mom, it's easier on me.
When you're sick, you don't feel like arranging transportation. A lot of the times you can't. They come to me.
Hey, Cathie, it's me. Hello.
Hi.
How are you?
I'm fine. I've had EKG done here. I've had blood drawn here. I just feel like she knows me. Like I'm not just a 15-minute appointment in her day. And when she comes in, I can talk to her like I'm talking to a friend. Like I'm talking to a really good friend. The benefit, not only to us as patients, but to them as being the kind of doctor that can sit down and talk to a patient and get to know that patient as a person, not just biological puzzle that they need to solve.
My mom has gone through some ups and downs health-wise, and Dr. Jossi has been on top of it. She's been addressing whether it's blood pressure, whether it's the falls that she's had. She had a stroke, and Dr. Jossi was very good about making sure she was getting the right care, whether it was physical therapy, speech therapy, change of medication. So she's been on top of it.
If you wanted a really rewarding job that supported you well in your skills and aspirations, some great relationships with your coworkers, as well as plenty of time to really get to know your patients, I think doing house calls is really the way to go. And I think the way that Housecall Providers is structured, it's embedded with support to allow you to do what you really want to do and gives you the time and the space to really do it. Providing care for patients that may not otherwise get that care and are getting it at a level that is just beyond what other community members are getting.